classified document for the U.S. government on world population. Now, I have a copy of that on our website, truthforhealth.org. And Henry Kissinger's classified document was later declassified, which is how I got it in open source. But his entire document prepared for the government was a proposal to stabilize the world population and begin decreasing the global population by at least 50% by 2015. And of course, no one knew that was there at the time except.
Welcome to the Deconstructing Conventional podcast. This interview is brought to you by Healing United, a private membership association committed to helping you reclaim sovereignty over your health, life, and future. You could say our tagline is question everything and rebuild intentionally. In the audio format of the show, there's additional commentary before each episode, and there are also over a dozen audio-only episodes. You can find the show anywhere you listen to podcasts, including the Healing United PMA app. Look for it in the App Store, and if you want to learn more about the work we do, and especially how we help people heal when the doctors have no answers, visit us online at healingunited.today. Now, on with the show. All right, hello everyone. Welcome to today's episode. So as you can tell from the introduction, I have an amazing guest for you today. We come from very different ends of the health world, but we share so many values and have a lot of overlap in the topics we both cover in the realm of health and vaccines and endocrine health and toxicity, but also in the realm of faith and sovereignty and really just being unafraid to speak truth and fight for freedom, and also a willingness to call out organized evil where we see it. And there are a lot of people who will point out corruption, but they just have a hard time crossing the bridge and publicly talking about organized evil. And both of us are willing to do it. And so here we are. And Dr. Vliet, you are a gem of a human being. And I know you are so busy. So thank you so much for joining me today. Welcome to the show. And it is an honor to have you.
Well, thank you so much, Christian. It's a real pleasure to be with you, particularly someone where we share our faith values and our desire to speak openly about that.
Right. Yeah, for sure. Well, I first came across your name when you were interviewed by Peter and Ginger Bregan, and they asked you to discuss the topic of depopulation, which you kind of reframed as eugenics, or that long-standing eugenics movement. And I was just blown away with your encyclopedic recall and level-headed, non-hysterical command of the ugly history. And when I heard you speak that we're wrapping up the interview and you were just getting going, I was like, no, we have to catch up. Part of why I was excited to talk to you is just your background, your knowledge base, but you're able to weave so many seemingly different aspects of life that are disconnected, or some of the threads we see in the news. And I'm confident I can describe you as a systems level thinker. You see things differently and help frame the big picture of what's going on and who's behind it. And I imagine the listener, or most of us today, we all sense that there's something just really off. And the way COVID played out kind of reinforced that. I guess the gaslighting, you could say, has never been higher or more obvious. And there's this glitching in our public thinking between, like, there's official reality, which, like, it keeps not matching the real reality or the intuition of what I think I'm seeing. And from, safe and effective to trust the science to there's nothing to see here, everything's fine. And we just all know something's not fine. So what I've come to understand about COVID, I guess, the culmination of it's like the latest iteration or culmination, if you will, of this organized, long-standing anti-human agenda that's constantly rebranded itself over the last 100 years. And prior to COVID, I had seen flashes of it, but I hadn't recognized the gross, depraved, organized evil that had been afoot and the way they had kind of weaseled themselves into the levers of power and covertly work to take over governments or institutions or have large scale influence. And as I started seeing that, as COVID unfolded, I was like, I can't unsee this. And so I'm just honored to chat with you today, because this topic forces some uncomfortable questions about, like, what in the world is going on? And why would people actually be so organized and methodical at doing something so emotionally or viscerally repugnant that just doesn't make sense to us, that people would want to, that have such a depraved view of humanity or have such an anti-human look at things? And part of where this topic is worth covering is you and I both realize if we can't see what's happening, if we don't have a frame for the big picture, then we don't have an accurate map of reality, and nothing in the news makes sense, or we always feel like something's off. And once that frame clicks into place, we can start to say, oh, that's really happening. That's gross that that kind of sickness exists in the world, but it's real. And so what do I do about it? And the question people have a hard time explaining is why would they do that or how is that possible? And you, as much as anyone I know, have an ability to zoom out and systems level think and show generationally through the historical record where this has been hiding. And so I guess before we get into a lot of the details of the timeline, just go ahead and define the word eugenics or how that gets conflated with depopulation. And then when did you start following this thread and start taking us through anything you want to comment on what I've just said so far?
Well, thank you. That was quite a broad overview. And eugenics is the 100-year plan to reduce the world's population in a nutshell.
Okay.
But eugenics says that the field of eugenics and those who espouse eugenics claim that their beliefs and practices aim to improve the genetic quality of the human population. However, they do so by eliminating those people and groups that an elite group of powerful people or wealthy people decide are the inferior people, those who are inadequate, inferior, less desirable, and they have a long-range plan to eliminate those people, elderly, disabled, minorities, those who are politically inconvenient, those who speak out are targeted. And this is something that most people with a conscience, with a set of goodness about them, and people who are raised, for example, to be Christians, or people raised Jewish, for example, the moral code of the Judeo-Christian traditions does not promote killing groups who are less desirable. And that, so it's hard for people to understand that. Mm-hmm. But you have to step back and understand two things. First of all, you have to understand the psychopathology of those who are pathological, malignant narcissists who believe in their total belief that they are better than other people. They are the ones who should make decisions for other people, and the means justify the end. Whatever I need to do to accomplish my agenda and my control over other people is justifiable because I'm so special. I'm so good. Mm-hmm. I'm so desirable. Yeah. I can do whatever I want. The law doesn't apply to me. You see behaviors like this around you everywhere. People who think they're entitled and who think they can do whatever they want. That's one part of it. That is the pathological, malignant narcissist whose aim in life is to control others. But there's the other dimension, which churches don't much talk about today, but you and I understand is very real. And that is evil exists. Mm-hmm. Evil is real. And Scott Peck actually came up with a beautiful acronym. Evil is live, spelled backwards. Evil is the opposite of the spirit of life. It attacks the spirit of life in another living being, whether it's an animal or a human. And you see people who are cruel to animals. You see people who are cruel to people. It's the same principle. It is evil playing out in this world. And the Bible is clear that evil exists. God gave authority over the world to Satan. Satan could have his way in the world, but God allowed the limits of Satan's action. And God controls the limits, and God ultimately controls all. But what we're seeing is a combination of extreme psychological pathology and extreme evil at the core of these people's souls when they want to suppress and destroy and kill and end the lives of other human beings and animals for a political agenda.
Yeah, there's this undercurrent, like some people have framed that as just some of the evil we see, or the gross, they'd call it corruption, is just a form of greed. And greed only goes so far to explain a lot of what we live through, because once they've got all the money, they can buy everything and there's no lever they can't pull. The only thing they don't have more of is power. And it's just this insatiable craving for more of it. And they see themselves, you're right, like this godlike role of deciding who lives and dies and pulling levers of power. And they're never able to satisfy that. And that's where so much of what we've seen play out is it slips into the evil realm. But okay,
that's a much bigger aspect than greed, actually.
Yeah, precisely.
Totalitarians aim for control and power more so than money.
Mm-hmm. Yeah.
And that is the bottom line for them. Now, people think that the Nazis invented eugenics, but they didn't. This came much earlier in the United States, led by Margaret Sanger. And I can give you the link to a 12-minute video by a military veteran and historian, Colin D. Heaton, Heaton, who did just a 12-minute overview of the history of Margaret Sanger. And she was the leading founder of eugenics in America in the 1920s. And she was very clear. She is on record in numerous speeches and writings as stating unequivocally that our goal in eugenics and in what came to be called Planned Parenthood, to hide the agenda of death, Margaret Sanger made it very clear that the goal was to exterminate Negroes, Indians, veterans, and the disabled and the mentally feeble. Those were her words in her era. She actually was the person who influenced Adolf Hitler, who then carried out all of the eugenics experiments and the extermination of Jews in World War II. But Margaret Sanger was the one who really led the way. And there was another group in Britain that came slightly after Sanger. But Sanger actually traveled to Europe and had the audacity and hubris to tell European women that they should stop having babies for 10 years because she believed that Americans should be superior.
Jeez.
and other things that were quite chilling, to hear her so callously say these things on the old clips from her presentations and very early interviews, is the fact that she talked openly about using the Negro pastor to push the ideas of Planned Parenthood so that people would not know the true agenda, was to reduce the number of Blacks. She said, she used the word Negro in her day, but we would say Blacks today. And that was a very dark beginning, but people don't realize that was the origin of Planned Parenthood. That 100-year plan has been carried on to the point that after Roe v. Wade was passed in 1973, the Planned Parenthood clinics escalated and skyrocketed in minority neighborhoods to the point that when I was writing about this 10 years ago, the statistics showed that 85% of the aborted babies in the United States were Blacks or Hispanics. It was definitely a cleansing of the minorities.
I did not know that. Wow.
Yes, that was 10 years ago. Anyone who wants to know what's really going on in the field of abortion can look at the real-time abortion clock. It's numberofabortions.com, and it's like the debt clock, ticking away dollars as we go into debt. The number of abortions time clock is ticking away human souls being killed through abortion.
Man.
And it's staggering. And you can look at the tiny percentage for rape or incest versus those that are just elective abortions. And the majority are in minority neighborhoods, Blacks and Hispanics. So that was the 1920s and 30s. And Christian, I want to just briefly comment before we go more about how the depopulation agenda has been carried on over the decades in many different ways. And there's a lot to the how and the why, but we'll cover that. But I want to mention, people will ask the question, how is this possible? Well, you don't have to look any further than modern history, because you already see that it's been possible in multiple countries. The Soviet Union Bolshevik Revolution in the 1917 was the beginning of the communist revolution, and Lenin and then Stalin and then his disciples after that all used exactly the same playbook. So it's not so much how do they get by with it. They've laid out their playbook for us. They've done it in the Soviet Union, Eastern Europe behind the Iron countries, or Iron Curtain under Soviet control, North Korea, Cuba, Communist China, Venezuela. Every single one of the countries that has become a totalitarian dictatorship has used exactly the same tactics. How is it possible? They have a long-range playbook.
Yeah.
Control healthcare, and they've perfected it. First step is control healthcare. If you control healthcare, you control people and their lives. Poverty, make as many people poor as possible so that they become dependent on the government. They can't really get food unless the government provides it. Number 3 is debt. Increase the debt burden so that people, again, become more dependent, and it drives people into poverty. Gun control. Every totalitarian country has confiscated guns. The only thing that stands between us and totalitarianism right now today in the United States, where we're already seeing a rogue government arrest political prisoners because they don't agree with their politics, is the Second Amendment. So confiscating guns was step 4 in every playbook they've used. If you can't defend yourself and the only people who have weapons are the police and the government, then obviously you're not going to live very long if you don't agree with what the government says. Welfare. Take control of every aspect of their food, their lives, their housing. Education. Get the children out of the family, indoctrinate the children in the educational system from pre-kindergarten right straight on up. And in fact, that was one of the agendas of the Rockefeller family supporting the feminist movement. Get women in the workplace so we can tax the other half of the population, and get women out of the home taking care of the children so we can put the children in daycare and schools where we indoctrinate them. It's exactly what the Soviet Union did, exactly what communist China does.
Yeah. Well, and there's an element to scarcity that they know is so predictable in the way that humans behave. The more scarce we are, we're time poor, we're money poor, we're energy poor, we become more easily controlled, and we start chasing more, and we become less involved in systems level thinking, and we're just in the immediate frame. And that's where they've got us. And they're so patient at rolling that out. So thank you for highlighting that. Anyway, continue.
Well, there are just four more that I'll just mention for people to have an awareness. The religion, remove God from the public sphere, take faith out of people's lives, which we've watched happen right here in America. They did it in every other country. Class warfare, look at all of the divisiveness and hatred that's been sown deliberately since the Obama administration took power. That escalated. That this type of class warfare did not take place in this country in large part after the Martin Luther King Civil Rights Act in the 60s, and things were really turning around. And then food control. We're looking today at all that's happened to sabotage our food supplies. Manufacturing plants are blown up, firebombed. We're looking at culling and killing of poultry flocks, cattle herds under the guise of a false test saying they have avian flu, finding an excuse to get rid of our food supply, taking farmland from from farmers, and confiscating water rights so that the farmers can't water their crops. All of this is going on right under our noses today. You've just got to wake up and look at it. And then control of money. You've interviewed Catherine Austin Fitts about the central bank digital currency. Once that money is under digital control of the government, you don't have any say so about how you use your own money, and it can be taken away from you if you don't toe the line on the narrative from the government, just as is happening in communist China today and has happened to some dissenters on the COVID narrative. They've been debanked and had their bank accounts frozen. So these 10 steps are always used, and all of them are facing us right now, today. So that's how it's being done. How is it possible? It's not only possible, it's already happening all around you.
Yeah, well, with that frame, like we kind of hope to frame the border of this puzzle for you guys, because there's going to be a lot of puzzle pieces of things you hear that may or may not make sense. And once you see the why and the how, the ideology and the mechanisms by which this happens, you can start to form a more accurate map of reality. And with that frame, then we can start to see these threads that previously didn't make sense or didn't have a context. And by showing the emperor has no clothes, that there's a real agenda afoot here, we can finally do something about it. So if those of you you're hearing this like, oh my gosh, that's a lot, stay tuned. We're going to get to the hopeful parts. But first, we want to just give you a history lesson so that you can see with clarity what really is going on these days. So, all right, carry on with your topic about eugenics and the agenda and how that has woven itself through history.
Well, let's carry on from the 1920s and 1930s, so 100 years ago, to the 1940s and 1960s, around the time of World War II. Now, we know about the Nazi horrific medical experiments. We know about the slaughter of 6 million Jews by the Nazis. But what most people don't know is that all of the research in Germany that was done during World War II to develop nerve gas, and prior to that, World War I, to develop nerve gas agents, that pharmaceutical research did absolutely increased the chemicals that were then, after the war, converted to herbicides and pesticides. The same nerve agents that kill humans kill insects. And so after the war, the pharma research in Germany was actually, on nerve gases, was actually used to then, some of the same companies just converted it into herbicides and pesticides that were spread into the soil, water, air, and foods on our agricultural products as they began using more and more of them, and commercial farming methods, not looking at some of the natural practices farmers used to use. Every one of these compounds is an endocrine disruptor. And I wrote about it in my book 20 years ago called Is My Ovaries Stupid? And I have chapters going into food additives, environmental chemicals that are all endocrine disruptors. They damage the ovaries, they damage testicles, and they damage both animal and human fertility. And we're seeing that play out over the years since then. Over my lifetime, we're seeing it play out with declining sperm counts in men, declining animal populations. We're seeing a decline in women's fertility that isn't just related to delaying childbearing or use of birth control pills. It's related to the endocrine disruptors in foods and the environment. And then in the 1960s and 80s, again, knowing the damage potential, the powers in control of developing foods, the big corporations, government subsidies and policies, there was a vast expansion in the 60s through the 1980s of the endocrine disruptor food additives and diets based on soy components that were not the soy form that Asian and ancient Chinese used, because they recognized that soy was toxic to the thyroid and fertility unless you fermented it. And most Americans don't like fermented soy products. So the unfermented products are what sells here as a health food, and yet it disrupts thyroid function, it disrupts ovarian and testicular function, can lead to premature menopause in women, it can lead to lower sperm counts in men.
And it's in almost everything.
Yes, it is. You have to be really careful to avoid it. And there are many other soy, lecithin and soy components have many other health complications. There's a whole book written, probably published about 10 or 12 years ago, called The Dark Side of Soy. And it really goes into what all the research has been known for decades on all of this. And it's quite staggering to look at the way in which soy components really interfere with the normal body function, and yet it's marketed as a health food. So that's another example. Knowing an adverse fertility impact, it was still marketed as a health food.
Yeah, I want to make an observation here because I'm trying to put myself in the shoes of the listener who's having maybe a hard time connecting the way that we've tinkered with the chemistry of our food and tying it closely to a depopulation or to a eugenics play. And one of the things I interviewed Zen Honeycutt several months ago, and she was pointing out the dramatic amount of toxicity in our food. And I had a moment where I kind of stopped her and said, hang on, because it was so off the charts. It's like, how in the world could this possibly be natural? And I asked her, like, I'm having a hard time coming up with another frame besides malicious intent to explain why there's this much toxicity allowed in our food. And she had a brilliant answer. She said, I can't judge intent, but what I can say is that the powers that be are well aware of this problem, and they're doing absolutely nothing to stop it, which just leaves us to wrestle with, why is this obvious problem? We know back in the late 1800s, early 1900s, the problem with metal toxicity. And yet that problem was allowed to go on until it was so obvious they wouldn't stop it. Same thing with DDT. And there's other examples where our food and medicines or makeups or what are so toxic, and there couldn't be more of a mountain of evidence. And yet there's no will to stop it. At some point, we have to step back and say, why? At some point we can say this maybe goes beyond greed. There's something else here. But what are your thoughts on where it's just that they didn't know what they were doing and they were just trying to help grow more food? And where does it, can we say it crosses the line to be something more malicious and nefarious going on?
Well, I think the very fact that, number one, as she said, they've done nothing to regulate it, stop it.
Mm-hmm.
But more importantly, they continue to expand the additives to food. They expand fake ingredients manufactured ingredients, microplastics, nanoparticles, preservatives that have inflammatory effects. And you cannot escape the fact that it's being done deliberately, because it's not only did they not stop it, but it's ongoing and increasing.
Yeah.
I mean, look at all of the things that Bill Gates is bragging about, creating fake meat.
Yeah. Yeah, that's a whole
And
different animal. Oh my gosh, the
the whole
slurry. Oh,
and putting out this idea that you will eat bugs for protein. They know that the human body does not have the enzymes to digest chitin, the component that makes an insect's exoskeleton hard.
mm-hmm.
Chitin is allergenic to about 80% of people. That means it creates gut allergies and gut damage and inflammation. So if you're eating foods with ground up cricket flour, you're eating something that your body can't digest and is allergenic.
Yeah.
And they know that.
Yeah.
So you cannot escape the fact. I don't see how you can escape at all the fact that they are doing it by intent, because they know the damage. It's the same with the COVID shots. They knew 20 years ahead of the rollout of the COVID shots in 2021 that this technology with lipid nanoparticles and mRNA damaged the ovaries and testicles in every animal species studied. They chose it anyway.
Yeah.
It goes, their actions go to their intent.
Yeah, you know them by their fruits.
Exactly. And that's biblical as well.
Yeah.
We know them by their actions. Scripture says, you shall know them by their fruits. This is the fruit of evil.
Yeah.
You cannot escape that. And I know that's hard for people to understand. But if you don't understand what you're up against, your life's at stake.
Mm-hmm. Yeah, there are people with interests way beyond your well-being and actually are antagonistic to your well-being. And once you kind of metabolize that, you kind of towel off and be like, well, that's the world we live in. I guess I should maybe adjust my strategy a little bit and realize that there is that afoot. So anyway, okay, carry on with your timeline of we got to the farmers in the 60s, 70s, 80s, and you're doing a great job. Keep going. I'm impressed.
Well, then in the 60s, I remember when I graduated from college and was starting to teach in the late 60s, early 70s, Paul Ehrlich's book, The Population Bomb, suddenly exploded onto the bestseller list. And he claimed he was a eugenics acolyte and proponent of no population growth. So in other words, zero population growth was the goal of his whole movement. And that dominated biology and science and the media for quite a long time. That was in the 60s. 1973, if you remember that year, Roe v. Wade was passed. And that opened the door to abortion on demand and the rapid expansion of Planned Parenthood, which was Margaret Sanger's creation in the 1920s. And in 1974, Henry Kissinger, dovetailing with the now available abortion across America, rather than based on state law, it had become federal law under this Roe v. Wade decision, and Planned Parenthood skyrocketed in its growth, taxpayer funded and donor funded. The goal was reduction of the minority population from the beginning. I know people don't like to hear that now, and Hillary Clinton praises Margaret Sanger as a hero of women. She was not a hero of women or humanity. Her belief was we should eliminate people she didn't like.
Yeah.
And that's her core belief. Then in 1974, a momentous occasion with Henry Kissinger's classified document for the US government on world population. Now, I have a copy of that on our website, truthforhealth.org. And Henry Kissinger's classified document was later declassified, which is how I got it in open source. But his entire document prepared for the government was a proposal to stabilize the world population and begin decreasing the global population by at least 50% by 2015. So in 1974, Henry Kissinger is proposing that the US government start decreasing population directly, at least 50% by 2015. And of course, no one knew that was there at the time except the government secret program.
Was his report the one that led to using contraceptives as vaccines? Like, is that am I remembering that?
That was one of them. That was one of them. Yes, there, and it was going on in pharma as well as U.S. government actions, and it was also aimed at minority groups in other countries.
Yeah.
The contraceptive vaccine research using vaccines to sterilize men and women was going on from the 1970s through the 1990s. In fact, one of our molecular biologists, toxicologists, actually was working on some of that research early in her career until she realized what they were doing. And as a Christian, she just couldn't stomach the work and left that field. But the World Health Organization and the Global Alliance for Vaccine Initiatives, funded by Bill Gates, were launching HCG, tetanus toxoid vaccines, in Africa without informing anyone of the presence of HCG, which led to the sterilization of young women. Gates Foundation also is accused of sterilizing women in India with his vaccination program. This has been going on for a very long time. There are many medical references on PubMed to support what I'm saying about using vaccines as contraceptive technology.
Yeah, it baffles me that so many people still see Bill Gates as some sort of like Mr. Rogers philanthropist do-gooder he's a wolf in sheep's clothing, and to fall under that spell, once you realize what he's funding and what it goes to, it's hard to see it any other way.
Well, Bill Gates is quite open in TED Talks over the last 25 years that he thinks there are too many people in the world. He thinks that we should reduce the population to 500 million, maybe a billion, from 8 billion. But of course, that means that he and those he prefers to have survive are the ones who survive. No, this is a very evil agenda. These are human beings playing God. And for those who don't remember all that was going on leading up to the time of Noah, this was happening in biblical times as well, where fallen angels, called the Nephilim, were mating with human women and creating hybrid beings. It was part of what led to God so angry and judging his creation for these despicable actions that he cleansed the earth in the great flood.
Yeah. There's some weird parts of the Bible, and there's nothing in the human experience that book does not capture. So
you're right. I've been spending a lot of time reading the Old Testament, and it's like, oh my heavens, we're seeing this play out today.
Yeah.
So, Christian, if you want me to keep going, I want people to understand the progression here, because you have all of this taking place from the 1920s through the 1970s. For 50 years already, we've kind of highlighted.
Yeah.
And then you move into I said the 1970s through the 1990s was the contraceptive research in using vaccines as contraceptive agents to sterilize people. Well, concurrently with efforts to sterilize people to prevent babies being created and born, the 1990s brought us the National Health Service Liverpool Protocol in England, which was accelerated euthanasia for the elderly and disabled. It served the purpose, of course, of getting people off of the government payroll for medical services. And finally, when that was exposed, there was so much hue and cry that they claimed they stopped it, but it just emerged in other forms. That also influenced Hillary Clinton in her secret healthcare task force in 1993, that Americans didn't know what she had planned in this secret task force that Bill Clinton authorized her to start. And it was highly secret. The only way that we later learned what was being planned was that Association of American Physicians and Surgeons sued under the Freedom of Information Act to get the records disclosed, got them released, and analyzed them. And Hillary Care, in her plans for the takeover of U.S. healthcare, eliminated all private medical care in the U.S. Everything was to be determined, run by, controlled by, and rationed by the government, similar to Canada, and unlike Britain, where they had private care available for those who could afford it and government paid healthcare for those who couldn't. All government care was controlled all medical care was controlled by the government in the U.S. Right before 1994, when the Egypt Population Accords, Cairo Population Accords, 194 nations signed on to an international agreement that there were too many people in the world. The world's population needed to be reduced in whatever way was necessary.
That's
And
basically
they
the entire
all
world.
signed on to it. Exactly right.
Yeah.
No, they all signed on to it. So you have the 1990s beginning early in 1990, the Liverpool Protocol killing people in the NHS hospitals to get rid of them. 1993, Hillary Clinton is setting up control of the U.S. healthcare system totally under the government for government rationing and decisions about who got what care. 1994, the Cairo, Egypt population controls. And then 1999, Ezekiel Emanuel in the US publishes his paper called The Complete Life System that proposed rationing all medical care or attenuating it. He didn't use the word rationing, but that's what he meant. He said attenuated medical care services for those under age 15 and those over age 50. So only people between 15 and 50 who had the potential for a complete life by his unilateral definition, one man deciding who got to live and die. That's the complete life system. He published that paper in 1999, and that became the basis. Hillary Care in 93 and Ezekiel Emanuel's paper in 1999 were the basis for Obamacare in 2010.
My goodness. Yeah. It's just most people don't know that history, or we remember those events. And I remember hearing Whitney Webb talk about, she wrote 2 books, One Nation Under Blackmail. And it's similar timelines to what we're talking about. It goes back many decades. And in the first volume of the work, the feedback she gets is like, "Oh, gross. I can't believe that's part of our history." And like, wow. And then as it started getting closer to our timeline, the feedback was like, "Ah, come on, that's like conspiracy and we're not sure." And there's just this uncomfortable nature of like, "Oh, this was in my lifetime and this is still going on, and it might actually be going on today." And we're presenting this so you kind of have the courage to face it, or the thread to see it follow through and know that it didn't go away. And whatever lipstick they put on this pig, it's still the same agenda. just rebranded in a different way, and they keep going and they just use sustainability instead of some other word.
No, you're exactly right. As soon as people understand what the words really mean, they change the words.
Right.
And that has been a pattern over my whole adult life. I'm sad to say that I'm of the baby boomer generation. It is the baby boomer generation that has led this Marxism drive to take over America. Yeah, that was not my desire, of course, because my DNA is from people who came to this country in 1608, escaping tyranny and escaping persecution, and survived the starving times from the first socialism experiment at Jamestown in 1609. So my literal DNA is made up of people who came for liberty, and people of faith who came to escape persecution, and people who spoke out and were survivors and fought against tyranny. In the first Revolutionary War, I have ancestors that fought in the first Revolutionary War. I have one of my ancestors, Richard Henry Lee, signed the Declaration of Independence at risk to his life. Yeah. So, there's no way that I could in any way endorse Marxist communism, totalitarianism. Every fiber of my being, it goes back to the basics of God's gift of life and liberty. But it's been the generation coming of age in college in the 60s. Yeah. First baby boomer born in 1946 after the war, that generation has led this Marxist fight. It was the Weather Underground revolutionaries who were baby boomers who led the riots in the Chicago Democrat Convention in 1968, who did the Capitol bombing, Bill Ayers, Van Jones, all of these people that we now know are in the shadow government in Washington were part of the Obama administration as his various czars. Ironically, they call it a czar, which was a Bolshevik term. Yeah. That they were co-opting the term of the Russian czars for ruler and using it for their Bolshevik revolution, Marxist revolution in Obama administration. Everything, don't you remember, everything during those 8 years was called a czar of this and a czar of that, healthcare czar.
Yeah.
Well, they're telegraphing what they're doing. So the point is that this is the generation that has led to the demise of the constitutional republic and our medical freedom, our religious freedom, and our ability to spend our money the way we want, and encroaching regulations. They're passing laws by regulatory action, not in Congress. And the sabotage of our food supply is occurring by regulatory action, not by any passage of a law. Yeah. And they're using false tests to do it. So when those in power know the consequences of their actions, PCR test, 90% false positive rate, according to the most recent data analysis worldwide, they know that it's false positive and they are using it anyway. Their actions tell you their intent is not to cure disease, it's to kill the animals.
Yeah, no, when you see it through that lens, you're like, oh, the plan is working. Like what they roll out, the PCR test is perfect. It will scare you and not be accurate. That's exactly what we need. Like
the weapon is fear.
Yeah.
Totalitarian playbooks always use the psychological weapon of fear to control the population.
Yeah.
Fear of dying, fear of loss of food, loss of money, loss of freedom. Any way that they can manipulate you through fear is another way they control you. Now, we have lots more to talk about in the ways that these controls have been insidiously placed on our lives. The vice has tightened dramatically in the last 4 years.
Mm-hmm.
But screws were turning against us
No, they were.
for at least since 9/11. And 9/11 was used as a way to justify the Patriot Act and then subsequently the anthrax vaccines that damaged our military. And following that, the gain of function studies,
Yep.
all of which have been used to kill and maim human beings.
Yeah. Yeah. Well, so as we start wrapping up here, I know you got to get back to your next patient, and we set up a second interview to kind of flesh out the rest of this history so that we can be current with their perceived the plans that we can tell of what they're up to. We want people to be very wise to those agendas. So give us a hopeful note to go out on, because I know this is heavy and there's a lot of ugly things in here, but tell us why you are so hopeful. I know both of us have in our businesses a faith over fear element, that we are passionate about making sure that we remind people that at the end, God wins this, and that there's always hope. And fear can be that check engine light that makes us, okay, hang on, I'm malleable now and likely to be unable to think clearly. So give us some hopeful news to go out on, and then we'll pick back up with it in our next segment.
Sounds great. And in our next segment, we'll start with the 21st century following the year 2000 and all that's happened in the last 24 years.
Yeah, plenty.
So we definitely will do that. But I think the most important message for everyone to consider, and it's what helps me face all of this and deal with the reality that my work has forced me to confront the fact that this evil exists. Harm to people is by design. Harm to animals is by design. And constraints on our freedom is by design. Mm-hmm. Partly, I did have the educational experience as a very young woman right out of college to participate in an educational mission to the Soviet Union.
Oh, wow.
Under the Soviet control. That was very frightening. And you can believe that as a young woman, newly out of college from the United States of America, I'd never seen anything like it.
Yeah.
And very, very chilling experience. And then 5 years later was on a similar mission, educational program behind the Iron Curtain country in Eastern Europe. So I did have the opportunity to see this totalitarianism up close and very definitely experience the fear that comes when you're constantly surrounded by armed guards and never knowing when you might be picked up by one and taken away. So what keeps us going in the face of that, and what kept people going in those countries, was their undying faith that there would be a way to find freedom if they just didn't give in. And the hope comes from what Dr. Viktor Frankl said coming out of surviving the concentration camp in Nazi Germany. The last human freedom is the freedom to choose your outlook and frame of mind in the face of adversity. And that's very much what the Bible tells us as well. And so I choose to look at this as, okay, there's a lot I can't do anything about, but what can I as one person do? What can I do to take better control of my health? How do I recover from multiple surgeries and get back to work? Whether it's something like that, or whether it's looking at, okay, I stopped drinking soft drinks in 1983 because of all of the additives in them. And there are other types of foods that I simply will not buy and will not eat because of all of the additives in them and because they're detrimental. And I'm not saying that I or anyone else needs to be perfect all the time, but I am saying that the hope and the confidence and the sense of accomplishment for each of us comes when we make a choice to do something that is in our best interest rather than giving in to someone trying to coerce or force us to do something against our best interest. Every time you take a stand, what did Dr. Martin Luther King say? Every time you peacefully sit at that lunch counter, whether you're served or not, you made a statement.
Yeah.
And you strengthened your own resolve to stand against evil. And in the bottom line, that's all God calls us to do. He calls us to stand against evil, heed his word, heed his commandments, and be a watchman on the wall to warn others.
Yeah.
And that's what you're doing. That's what I'm doing. I
Right.
can't fix everything, but by gosh, I can certainly use the time I have to teach people what they can do to be healthy and to be prepared and to understand what's coming at them. And Christian, the Lord gave me, first of all, it was the Lord who called me into medicine from another career. And that was a shock. I was happily married for 5 years. I'd finished my master's degree, wasn't thinking about going to medical school at that point in time. And Jesus said in a dream, you are to go into medicine and become a physician and leave teaching. Whoa. And it was as real as if he was standing there at the foot of my bed that night. Maybe he was. But from that moment on, really, this has been about doing the best I could to discern what God wanted me to do. And God designed the tapestry of my career and all these crazy quilt pieces of experiences that help me see the big picture. And it's a gift of the Holy Spirit that I see the pieces of a kaleidoscope as if they're already in focus. So I see these pieces of the puzzle, and it's like I see how the picture comes together. It's the way my mind works with patients. It's the way my mind works when I see patterns like what's been going on and pulling all these threads together and say, oh, well, they're doing this over here and they're doing this over here. And they're doing this over here, but they all go to the same end result.
Yep.
And I do think that's a gift of the Holy Spirit. So I would encourage people, tune into what God is guiding you to do and say and act. And if you haven't been taking the time for devotional and prayer time, do that.
Yeah.
That's what helps us discern the truth about evil exists and how do we stand against it. So I think that's what you and I both ultimately want to impart to people. And I suspect you, as well as I feel strongly, I don't want to stand before God on Judgment Day and say, well, sorry, I didn't try. You know,
So
I could not be silent. And I wasn't going to let people during COVID die on my watch. If there was anything I could do to help them, I didn't care what the Arizona governor said about you can't do this, you can't do that. He's not a physician. He didn't take an oath to serve the patients. And I did. And I took that oath before God. So if you don't like it, I'm sorry. But I don't answer to you at the end of my life.
Yes, if the listener could see me right now, I've been bursting, just like enjoying, nodding, and all the things you're saying, because it just resonates. There's a reason you and I click, or that I'm so appreciative of your work, because you just say things well, and you're not coming across as fearful, nail biting, this chicken little skies falling. Oh my gosh, this is horrible. And you just like, this is real. So let's do something about it. And the most commanded thing in Scripture is don't be afraid. And apparently we hear that repeatedly because there's enough things to make us afraid. And when we realize that God's command, when he says, to any of the people he calls, and they kind of give him like, oh, but what about this? He's like, irrelevant. I'm going to be with you. So what's the big deal? And sometimes we so easily forget that frame when we see these topics. And so take comfort, like she said, go back into your prayer closet, just ground yourself, get around the people that have life and hope and speak truth. And you'll find it's way more fun to be involved in what she talked about. What can you do to influence the outcome? Go do that. And this is our humble attempt to do that today, just to pick up our microphones and share some of what we know, and we'll let God do the math of where this goes. But thank you so much for your time. Any parting thoughts before we call it a day for this episode?
Well, I was just thinking as you were speaking that one little practical thing I did when they started killing all the chickens last year, or no, in 2022, they started making up excuses to kill all the chickens. And I thought, uh-oh, we're not going to be having eggs readily available. So I started raising chickens in my backyard.
One more thing I like about you. Fantastic.
I literally still to this day, 2.5 years later, still have my chickens. One of them died. I still go out, feed the chickens, and have a little bit of peace and sense of, okay, I have one thing that I can actually grow in the desert, that the chickens are growing and I feed them so I can have some eggs.
Well done. No, it's simple, but it's grounding. So well done.
It is grounding. It is very much so. And so I'm saying all this to people because I want you to see there's so much that you can do, that if you just look beyond the fear mongering and the headlines, because there's a lot we're creative people. God designed us to be creative and problem solvers. So put your mind to work and go do it.
Right. Well said. All right. We'll call it a wrap there, and stay tuned for the second half of our conversation in the next episode. Dr. Vliet, thank you so much for your time today.
Thank you so much, Christian. I love doing this with you. It's quite a lot of fun.
Right. Oh,
thank you.
Glad to hear it. Okay. We'll talk soon. Thanks for listening to Deconstructing Conventional. If this conversation sparked new questions or helped you see things in a new light, feel free to share it with a friend who is on a similar journey. Don't forget to subscribe so you never miss an episode and a perspective that challenges the norm. Check us out on our website at healingunited.today and find us on social media at Healing United, or you can check out the Healing United PMA app. It's a great way to stay connected. Remember, question everything and rebuild intentionally.